Updated December 2, 2017 150,306 A pre-election pledge by South Australia's Labor government to spend $90 million to boost services at Adelaide's Modbury Hospital has been welcomed by the Australian Medical Association AMA, but it says more beds are still needed across northern Adelaide's health system. Some Modbury services had previously been downgraded under the SA government's transforming health policy, including a high dependency unit which will not return under the latest pledge. AMA State President William Tam said a boost to surgical capacity would be good for the northern suburbs, but capacity also needed a boost at the Lyle McEwen Hospital, also in northern Adelaide, to ensure patients got the highest standard of care. We have suggested that the minister look at increasing the bed capacity of intensive care at Lyle McEwen Hospital, to increase the number of beds from 14 to at least 20, Professor Tam said. At the moment it is very difficult for Modbury Hospital doctors to negotiate a bed for patients at the nearby Lyle McEwen because it lacks capacity. The Labor government, seeking a fifth consecutive term when it goes to the polls next March 17, is promising the changes for Modbury Hospital as it seeks to shore up its electoral prospects in key electorates of Adelaide's northeastern suburbs, with a former Labor member Francis Bedford running as an independent in Florey and high-profile Nick Xenophon contesting the seat of Hartley. More elective surgery promised Labor plans to spend $35.4 million on an acute surgical unit for Modbury to allow a wider range of elective surgical procedures. Another $9.2 million would extend emergency care, and there is a promise of $8.9 million for an acute medical unit. Modbury's aging infrastructure would be upgraded at a cost of $22.5 million, and $15.6 million is being earmarked to build a palliative care facility. South Australian Health Minister Peter Malinauskas said there had been wide consultation with the local community, clinicians and hospital staff about changes needed at Modbury Hospital. By investing in an acute surgical unit, more residents in the local community will have access to a range of elective surgeries, including multi-day elective surgeries, he said. This announcement is part of how this state government is ensuring residents living in the northeast of Adelaide have safe access to a wide range of medical services closer to home, he said. Florey MP Francis Bedford, who is no longer with the ALP, has campaigned to boost Modbury's services, and the Liberal opposition recently promised $20 million to restore Modbury's surgical capacity and upgrade its emergency services. Clinicians guarding their own patches. Opposition frontbencher Stephen Wade said the upgrades announced by the government still fall short of what the people of the northeastern suburbs need. The government has refused to reinstate the high dependency unit, which is a foundational service that is needed for the expansion of elective surgery, for the safe operation of the emergency department, and for the support of a whole range of other services in this hospital, he said. Retired clinician Warren Jones said the recently appointed health minister had been poorly advised about the health needs of the northeast, having been led around by the nose by a group of clinicians who are guarding their own patches, or they are comfortable in what they're doing and they don't want to rock the boat. Ms. Bedford said she remained keen that northeast patients did not regularly find themselves being transferred to other hospitals. I'm not a clinician, but there are methods and ways to have a higher level of care here, and that's what we're trying to do in a bid to reduce the number of transfers, particularly for all the people in this area who live in retirement villages and nursing homes, she said. They are the ones who are being whizzed around in ambulances. Topics: healthcare facilities, health policy, health, states and territories, elections, government and politics. Modbury 5092, Elizabeth Vale 5112, Elizabeth 5112, Adelaide 5000. SA first posted December 2, 2017 141,723.